Recorded Books presents Science Denial, Why It Happens and What to Do About It, by Gail M. Sinatra and Barbara K. Hofer. Narrated by Nan Mcnamara. Preface. Science denial, doubt, and resistance have been persistent and growing problems in the United States as well as in other countries. At no time, however, have the consequences been as deadly as in 2020, with a global pandemic ravaging the world's population, spreading rapidly when unchecked, fueled by denial of its lethality and the steps needed to contain it. At the same time, the effects of climate change continue unabated, threatening life on this planet. We have never felt more passionate about the need for this book and our desire to help others make sense of the psychological explanations for science denial, as well as learning how to address it. The day we submitted a draft of this book, February 25, 2020, the U.S. Centers for Disease Control and Prevention, CDC, alerted the nation to the potential community spread of the novel coronavirus. At that time, only 14 cases had been documented in the United States, with the first U.S. case confirmed more than a month earlier on January 20th. When we drafted this preface, in mid-June 2020, the world had exceeded 8 million cases, with a full quarter of the cases and deaths in the United States, which has only 4% of the world's population. A reported 22 states were seeing their highest number of positive tests of COVID-19, most likely as a result of reopening restaurants, gyms, and other businesses, in spite of what scientific interpretation of the data suggested. Now, just 9 months later, in March 2021, the world has had 120 million cases, and the United States continues to lead the world in the spread of the virus, even as increasing numbers of people are vaccinated. More than 500,000 in the United States have died. Yet, some elected officials have failed to model the most basic protective behaviors of social distancing and mask wearing recommended by the CDC. Throughout these months of the pandemic, science denial has indeed become deadly. The scientific and medical community warned that the virus was dangerous and that unprecedented steps were immediately necessary to limit the potential catastrophic impact. The United States was slow to act, however, in terms of testing, contact tracing, travel limitations, and orders to stay at home. Scientists quickly worked to make sense of the novel coronavirus and the disease it causes, COVID-19, with an understandable degree of uncertainty in the epidemiological modeling and in the early advice about prevention, with no clear-cut predictions about when vaccines and treatments would exist. Yet their growing knowledge did not translate to policy at the national level. Within weeks of the onset of the virus, a barrage of confusing, misleading, and inaccurate information spread faster than the virus itself. Misinformation was coming from all corners: politicians, newscasts, social media, dark web conspiracy theorists, and even the presidential briefing room. Never has it been so imperative that individuals have the skills to understand scientific inquiry and know how to evaluate what they read and hear. Nor has it ever been more critical that policymakers listen to scientists and make use of scientific data to guide decisions to protect their communities, states, and countries. The first vaccine received emergency approval in mid-December 2020. Others have followed, and the rate of vaccinations grows. Yet worries persist about whether enough citizens will choose to be vaccinated, a deeply concerning problem when such decisions affect others' lives, not just one's own. As the virus has raged, the differential and more damaging effects on those who are Black, Hispanic, Latino, and Indigenous have become increasingly evident. Disparities in access to quality health care and overrepresentation in jobs deemed essential exposed the impact of systemic racism yet again. Racial gaps were evident in all age groups, and most pronounced in middle age, with death rates at least 6 times higher for Black and Hispanic Latino individuals than for whites. Such differences also exist for Alaska Native and American Indian groups compared to whites, but incomplete data
Sample complete. Ready to continue?